The United States is one of the most developed nations in the world, but when it comes to the maternal mortality rate, women dying during pregnancy or in childbirth, health experts say we are failing. The latest Centers for Disease Control data shows there were 1,205 maternal deaths in 2021. That is a spike compared to 861 deaths in 2020 and 754 in 2019. But Congresswoman Robin Kelly wants to help change that, and she joins me live now to discuss how she hopes to do it. First of all, good morning, Congresswoman, and thank you so much for joining us.
Thanks for having me.
You're set to formally introduce your Care for Moms Act tomorrow. Tell us about what it is.
Sure. The Cares to Mom Act is actually an extension of what I've been working on, which was the Mamas Act. But it's community access, resources, and empowerment. And we will work to give more access. My district is urban, suburban, and rural, and a lot of my rural moms live in maternity deserts. We want to build up the doula workforce. We want to make sure that moms, their WIC programs are extended for 2 years so they can get milk and things that they need. We also want to make sure that moms and pregnant moms and babies can get oral health that they need. That is very, very important. We want to see reports from HHS about where is the grant money going that has been allocated. We want to make sure that it goes to the places that really, really need it. There's been reports that sometimes the places that need it most around the United States are not getting the money, the grant money that's been allocated. We want to see more work around implicit bias and making sure that healthcare providers get the training they need so we can work as much as we can to do away with implicit bias, because it's been said that it's a racist system that causes Black women to die 3 times the rate of their white counterparts.
And I wanted to touch on that, and we'll go back to that in just a bit, but what is the prevailing thought on why the U.S. lags so far behind other higher income nations on this issue? I mean, are there any, you touched on some things, but why are we behind other developed nations?
Well, I've heard, over and over, and we work with a lot of professionals that a part of it is the implicit bias, the racist system, the lack of access. Women are not listened to as much as men, and Black women and women of color even more so. And we've heard stories where providers think that Black women can take more pain than other women. So all these things feed into it. And again, lack of access and lack of resources.
So we were, you had touched on it and then you just brought it up again, but 3.5%, right? That 3.5 times is how often Black women, how more frequently they die than white women. Is that the correct number there?
Right. That's 3 to 1. That's the average, but depending on where you are, it could be higher than that. It's higher than that in Chicago. It's higher than that in New York and other states also.
And you mentioned it as a racist system, but is this one factor in this because healthcare, they don't have insurance, because the access to healthcare is so less available? I mean, are those some of the factors?
Oh, no, I definitely think that's a part of it, too. The lack of access, living in maternity deserts. We led the way for those on Medicaid. Instead of just being covered for 2 months postpartum, they're now covered for a year. We gave states that opportunity, and 37 states took advantage. I'm proud to say Illinois was the first. But we also want to see through this new act that every state has to do it, because it definitely saves lives. Again, we have worked with healthcare providers, OBGYNs, to come up with some of the things that we've come up with.
So, Congresswoman, one more thing. I know the Mamas Act passed with bipartisan support. Do you have bipartisan support for this bill? And I'm going to have to ask you kind of for a quick yes or no here for time purposes.
Well, I'm working with one of my colleagues that we have a bipartisan maternal care committee. So I'm hoping that she will be on board. Parts of the Mamas Act passed with bipartisan support, all the things we've been able to get passed.
All right. Thank you so much, Congresswoman Kelly, for joining us this morning. Keep us updated on the bill's progress, and we hope to hear of its success. Thank you again.